Now, looking at the next congenital issue, which you can have in the gastrointestinal system or gastrointestinal tract, this is what is known as a Hirschsprung's disease. Hirschsprung's disease, rather. So here we're not going to discuss the disease, but rather we're just looking at what the issues that the patient having this disease condition is likely to face. That's the signs and symptoms. So for Hirschsprung's disease, you can see that there's basically what an enlargement, so much enlargement of the small intestine. All right. So what could be the issues? So it's most common in newborns, and most issues include there's delay in passage of the first stool. So let's look at them in depth. So in neonatal presentation, you give birth to a baby and the baby has not stool in 2 days, 1 to 2 days. It's a classic sign. I see that the abdomen is distended, the baby is vomiting, and there's greenish vomiting. That's bilious vomiting. So poor feeding and irritability. Then enterocolitis, which is like a life-threatening complication with fever. So for infant and childhood presentation, there's chronic constipation since birth. Abdominal distension usually worsens after the person eats. The stomach will be more distended. Failure to thrive or poor weight gain. So the person is not growing as they are actually supposed to, a whole lot of things. Then explosive stool passage after rectal examination. Alright. Then ribbon-like stools. Okay. So these are the various clinical features. That's basically trying to look at the signs and symptoms for Hirschsprung's disease.